Thank you for enrolling in Best Practices when Working in Healthcare Facilities, a part of the Priority 1 series of courses for healthcare physical environment workers. We hope you will find this training informative and serve as a roadmap as you perform work in healthcare environments. While the healthcare organization has the responsibility for managing security risks, it is your responsibility to follow their procedures. In most healthcare facilities, contractor employees must sign in and get an identification badge. Proper identification must be worn at all times. It is your responsibility to safeguard access cards and/or keys issued in your name. Be sure to report all misplaced cards and keys to security immediately. Do not wait until the close of your work shift. Facility security will be compromised if these items fall into the wrong hands. Healthcare facilities have special emergency codes in the event there is a breach of security. It is up to you to know which emergency is associated to each alert. If the healthcare organization gives you a copy of these codes, you should post it at your workstation for quick reference. This is important to help you follow proper procedure. One of the most concerning emergency codes is active shooter. It's unfortunate that such training should be necessary in a place of healing. If you encounter an active shooter while performing your job, as well as in your day-to-day life, here are a couple of actions you should keep in mind to help you, your associates, and loved ones stay safe. The first is the statement, "See something, say something." Second, if the healthcare facility where you're working sounds the alert for an active shooter, you should follow the run, hide, fight training. Run if you can, hide if you cannot run, and fight if the first two options are not possible. There is one more important thing to remember if you are forced to run from an active shooter. Always hold your hands above your head and open your palms if you see security staff or law enforcement. According to the Bureau of Labor Statistics and the National Crime Victimization Survey, workplace violence is a threat to those in healthcare and social service settings. From 2011 to 2013, 75% of all workplace violence cases reported nationwide occurred in healthcare and social service industries. So, what are the primary reasons for workplace violence in healthcare? First are the unique characteristics of certain areas of a healthcare facility, such as acute psychiatric services, long-term care settings, and high-volume urban emergency departments. Physical environment workers must obtain permits when applicable. Work permits do not have a common template shared across healthcare facilities. Therefore, you should read the permit and make sure you follow that particular facility's procedures. With an above-the-ceiling permit, a rule of thumb is to allow one tile removal per 50 square feet without any additional precautions. What happens after above-ceiling permit work is finished? All ceiling tiles must be replaced and in the same condition as they were when you started the job. A hot work permit is required anytime welding, brazing, or soldering or open flames are used. A technician should not work on any type of energized equipment unless he is a licensed electrician properly trained in the National Fire Protection Code 70-E.